So venous stasis is really common because a lot of people have poor circulation in their legs. And so a lot of times if you look at their legs, there's some swelling, there's some redness, hardness, maybe some itching, pain, some coolness. And one of the signs of lack of circulation is you can't feel their pulses in their feet. And a lot of times if you look at men especially, they have no hair. And so they may be hairy all over their bodies, but if you look at their legs have no hair. And the reason why that is because it's like not watering the plants. If you don't water the plants, they'll die. And so the more lack of circulation there is, the less hair they'll have. And if you ask them, oh yeah, I used to have hairy legs when I was young, but look how hairless they are now. And it starts near the ankle, and as their circulation gets worse, they lose more hair as it goes out because we're not watering the plants. Okay, and sometimes you can even see one side having hair and the other side doesn't. And we blame it on socks and all kinds of things, but it could be circulation if they have the coolness, the swelling, risk factors, and lack of pulse. Okay? And sometimes it gets so red that we think of it as, well, it must be infection. And so people are treated with antibiotics all the time, and it has nothing to do with an infection. The redness is because of the inflammation from not having good circulation. And so if you look at it, if it looks symmetrical, if it looks like it's red on both sides, then it's probably less likely infection, because infection is kind of rare to have it on one side, but to have it on both sides equally, think venous stasis or circulation issues as cause of the redness, especially if it's cool and not warm. Okay. So Rita asked about venous stasis ulcers. And so the most common ulcer found between the knees and the ankle are actually venous stasis ulcers. And so they actually say that up to 60 to 80% of any ulcers on the legs are probably venous stasis ulcers. Okay? And it usually takes a long time to heal because the circulation is not there. And so what causes venous stasis ulcers to form is just that because the circulation is so bad, there's lack of oxygen and lack of nutrients to that area, so the tissue starts dying. And so the ulcerations are very common. If you have venous stasis, then usually it leads to ulcerations. Especially if you have any kind of minor trauma. So if we have a abrasion, a skin tear, a poke, a scratch, that doesn't heal, and sometimes they'll just become bigger and bigger because it doesn't get oxygen, doesn't get nutrients to that area. So the ulcers are very stubborn, and they just get worse and worse and worse. So the risk factors are obesity and weight, and so it's putting pressure on the already poor circulation, so that makes it worse. Immobility, so if you are bedridden for some reason, or you don't exercise, or you just sit around, the more immobility that you have, the more likely you'll have venous stasis ulcers, because the calves, when they move and are used, it acts as a pump to improve circulation. So if they have already bad plumbing and the pump stops, then that increases the risk of venous stasis ulcers. If you had a blood clot in the past, or you have a blood clot now, that also affects circulation, so the ulcerations are more likely to form. Varicose veins. So if you had varicose veins in the past, basically it's often caused by the valves being faulty, so circulation is impaired, and so it settles where gravity settles. And so if you have varicose veins, you're more likely to have venous stasis ulcers. If you had varicose vein surgery, where you stripped the veins, then we made the circulation worse because we took out some of the plumbing. So if you had vein stripping in the past, you're more at risk of getting venous stasis ulcers later on in life. Any kind of injury, especially major injuries such as fractures, will impair circulation. So a lot of times if we do surgeries, we damage the plumbing, or the injury itself will damage the plumbing. And so that will increase the risk of ulcerations. And again, hip surgeries, knee replacement surgeries, anything in that area damages the area so that they're more at risk of venous stasis ulcers. Age, if you're over 65, the older we are, the plumbing gets older, just like in a house, and so age increases the risk of venous stasis ulceration. So if you're 65 or over, you have an increased risk of ulceration by at least 4%, and that probably gets worse as we get older. Anything that affects the plumbing, diabetes, high blood pressure, smoking, any of the common risk factors also increases our risk of ulcerations. If you're a woman, you're more likely to get venous stasis ulcers than a man. And you can think about, well, it might be hormonal, but one of the reasons that maybe it's true is because the blood vessels of women are much smaller, and so they're more likely to be compromised. Just like women are more likely to have osteoporosis because men have bigger bones to start out with, and so if there's damage to the bones, it has much more leeway. Whereas women, if they have smaller blood vessels to begin with, they're more likely to have compromised circulation. So women are at higher risk. So if you look at our patients, it may be coincidental, but a lot of our women patients have venous stasis ulcers. It usually takes a long time to heal because, again, they're not getting good blood flow, so they don't get nutrients, they don't get oxygen. So what caused them in the first place is keeping them from healing. Especially if they're not eating, then the nutrition gets even worse. And so it takes many of these over 6 months to heal. In about 33 to 60%, it takes longer than 6 weeks. So it's just not something that's going to go away really quickly, like a skin knee or something. It's going to be really stubborn. And so for us to make promises of healing, especially under hospice, it's probably low likelihood of healing because they're not eating, they're immobile, and they have risk factors that cause them in the first place. So a lot of times for us to try to heal them, it's probably going to be an uphill battle. And if it does heal, you should pat yourself on the back because it's not an easy thing to do. So these are signs of poor prognosis. Okay, so if you looked at a venous stasis ulcer, how confident are you that this is going to heal? And so if it already was going on for a long time, the longer it's been there, the less likely it's going to heal. So they use a cutoff of 1 year. So if that venous stasis ulcer has been there for a year, which is a long time, then it probably will not heal. The larger the wound, the less likely it's going to heal. The other thing is the fibrin deposit. So if you look at an ulcer, a lot of times you see the yellow discoloration. So that's fibrin. That's the body trying to heal this open wound. But the bad thing is that the more fibrin that's there to heal this wound, the less likely it's going to heal. And so what's happening is it's sort of like this thick fibrous tissue that's kind of blocking circulation, and it's also making the blood flow or the nutrients and oxygen even harder to get to that area because you have all this scar tissue there. So the body's trying to do the right thing, but the more the right thing that it's trying to do, the more it's going to make the ulcer harder to heal. So if you look at the wound and half of it or greater is yellow, then it's probably not going to have a hard time to heal because it's blocking the circulation, blocking the oxygen, blocking the nutrients from getting to that area. So even though that's a natural process, it's also making venous stasis ulcers harder to heal. And again, if you had vein stripping or anything else, that also increases the chance of it healing much less. Okay, so those are something as healthcare providers, you can look at the wound and how likely is it to heal. Now, treatments aren't very good, otherwise we wouldn't be waiting 6 months to a year to have these things heal. So typically you want to debride the wound as much as you can, because again, all that scar, slough, everything kind of keeps the nutrients and the oxygen from getting to the area. So debride as best you can, keep it clean, keep your infection risks down, and then compression, whether it's stockings or ACE bandages, you want to add compression, but not so much compression that obviously it makes the circulation worse. So if they get cyanosis, numbness, tingling, anything else that's telling you that we're putting too much compression on, that's not a good thing. So compression is good so that the fluid doesn't go to that area, but too much compression, we're making the problem worse as well. And if you add compression dressings or bandages or whatever, they kind of say that if you change it 2 to 3 times a week, that's enough. You don't have to change it every day. Okay. And so there's all kinds of fancy dressings and fancy things, but really they're just, the bottom line is it's going to be stubborn to treat because the underlying cause of it doesn't go away. And so those are venous stasis and venous stasis ulcers. So, any questions?